PCI improves clinical outcomes in patients with STEMI and in some high-risk patients with non-STEMI. However, these are also some of the same patients who are on agents that will increase the risk of bleeding. So there's a great interest to reduce such bleeding, and one of the ways to do that is being studied in the Radial trial, the Radial versus Femoral Artery Access site trial. We're talking with Shamir Mehta, who is McMaster University, Hamilton Health Sciences, Ontario. And tell me first about the Radial trial.
The Radial trial was a multinational study of 7,000 patients, which compared radial to femoral access in patients with acute coronary syndromes. Most recently, we've looked at the data stratified by whether patients came in with a STEMI or whether they had a non-ST segment elevation ACS.
And in the paper that's going to be published December 18th in JACC, and it is online now, so if you're interested in reading the paper, go to JACC Online. What specifically were you reporting?
We were reporting the differential outcomes in the STEMI population of patients, large number, 2,000 patients, and in the non-STEMI patient population, 5,000 patients, and we reported the outcomes separately. And what we found was that there was a substantial benefit of the radial procedure, particularly in the STEMI patient population, where it reduced the primary outcome, it reduced the composite of death, MI, stroke, and it reduced all-cause mortality. In the non-STEMI population, by contrast, we did not see those same benefits. We did see in both populations that the radial approach reduced major vascular access site complications.
So for bleeding, this is actually bleeding control, lowering risk. This is a good approach.
Well, certainly the radial approach will lower major vascular access site complications. That's clear, and that will be seen in both STEMI and non-STEMI patients. The difference is that in STEMI patients, there appears to be a reduction in mortality. Certainly that's the data in the 2,000 patient cohort that we saw in this trial, and that's been externally replicated in other studies as well.
Now, assuming you're facile in this particular approach, what patients would you want to use it on?
Well, I think the key is getting experience, and experienced operators certainly should consider the radial approach, probably in most of their patients. It's important to note as well that femoral access site complications have come down tremendously. And that's an important caveat. So femoral operators, if that's what they feel comfortable doing, should continue to do it. Right. There is a significant learning curve with the radial procedure. It does take time, and it does take a number of procedures in order to become proficient.
Now, in another JACC paper that's published in the November 13th issue, the CATH PCI registry data is showing radial artery access was used in 8.3% of diagnostic procedures. This is back in all of 2010 and about half of 2011, and about 6.9% of PCI procedures. Now, I've been to ESC this year and EuroPCR, and I can tell you they're doing a lot more of these procedures overseas than they are here. Why?
Well, traditionally, the U.S. has been the lowest users of the radial approach globally. Its use is well over 50% and probably over 70% in Europe, Canada, Australia, the UK. In the U.S., those numbers that you just quoted are actually higher than what they used to be. So it is on the upswing in the U.S. And I think this will be data-driven. As the data come out showing benefits of the radial procedure, new fellows will be trained in how to do the radial procedure, and more centers will be coming on board.
Do you think the Radial trial results is something that will get people's attention and maybe get them to think, maybe I should look into this?
Well, the overall results of the Radial study, when you include both patient populations, was not significant for the primary outcome. At the end of the day, I think it's important as interventional cardiologists that we have a number of techniques that we can use. I think all interventionalists should be relatively proficient at both radial and femoral, and at the end of the day, there's a patient at the end of the catheter, and we always have to consider that patient first and what would be best for that patient given the expertise that we have.
And is there any other follow-up to come from the Radial trial?
There are many sub-analyses that'll come. It was an extremely robust study, 7,000 patients, and stay tuned.
This particular analysis of the Radial trial data is in the December 18th issue of JACC, but if you want to go online and read it now, it is online before publishing. I'm Rick McGuire, Executive Director of CardioSource Interventional News.